Air is one of the things that I think so many people took for granted during the pandemic. And then suddenly they thought, oh my gosh, is the air contaminated? Or I don't have PPE, I don't have a mask. And suddenly we started to second guess the safety of that utility that we all thought was okay, right? Because we thought, well, we've got an HVAC system, it's filtering. Well, in reality, even if we have HEPA filtration, that's not capturing every single thing. And so our goal is complete safety, right? Preventability of healthcare associated infections or certainly disease associated with that. That's both for the patients as well as the caregivers. So, from a caregiver perspective, we want to make sure staff know that we're continuously disinfecting the air, that we're monitoring it for safety, and that we're using that data to make good decisions, both good and bad, right? To say we're performing well, we're not performing well, let's make some adjustments. From a patient perspective, I think there's an added layer of complexity to this, which is reputational management. So if I've got hospital A and hospital B right across the street from each other, if I'm a patient choosing an elective procedure and I know hospital B has got a continuous air disinfection device that's got scientific proof in the peer-reviewed literature that it works and it reduces SSIs versus hospital A that doesn't, and I'm having surgery, I'm choosing hospital B every day of the week, right? So I think there's an increased potential for confidence building with facilities that are using devices, whether it's air disinfection or other types of surface disinfection, or whatever it is from an infection prevention and control perspective that's evidence-based and really proven to improve outcomes. I think that's an important conversation for us to have both at the patient as well as the provider level.